The family that comes to me consists of parents who are not present and who substitute for that presence. Mom, I have everything now. I want you. This changed everything for me. Welcome to the podcast on the Divã with Dr. Andréa Vermont. This space of knowledge, this space where we talk, chat. As I always say, I bring here the greatest experts in the market, each in their area. And for me, it is an immense pleasure that you are here with us today. Our proposal, in fact, the purpose and mission of this podcast, as I always say, is to bring knowledge that liberates. I firmly believe in that. Knowledge liberates. I really like a phrase from the Bible, and I will always bring this verse that says, "My people perish for lack of knowledge." I firmly believe that knowledge liberates us. When we know Aqui, we make better choices. And we at the podcast on the Divã with Dr. Andrea Vermont have a large, gigantic, wonderful team. The success of this podcast is due to each one of them. I am just the anchor of the podcast, especially my guests, who are always very relevant people. The best. I'll be back. In other words, the best in their specific field, so that you can, based on everything you'll learn here with us, make better choices. And today we have a very special guest. Today we're going to talk about a topic that always comes up whenever I'm on Instagram, YouTube, and social media. Today we have over 15 million followers across all social media platforms, but whenever I talk about this subject, the response is enormous. Childhood, adolescence, mental illnesses affecting childhood and adolescence, excessive screen time, overdiagnosis, medication or not for children and adolescents, parenting perspectives, how parents are positioned today regarding their children's mental health. In short, an extremely dense and important subject that can generate a lot of change in your life, in the way you lead your family, in the way you raise your children. Today we're going to talk about mental health in childhood and adolescence. Today I bring to you Dr. Vanessa Menezes. Vanessa is a highly relevant professional, one of the best in the market that I know. I, who have been in my practice for so many years, I've always had immense difficulty finding a psychiatrist to whom I could refer a child or adolescent. Getting a psychiatrist who treats children and teens is extremely hard. And when we talk about a good psychiatrist, a psychiatrist who has human values, a psychiatrist who also has children and understands this whole approach, then things change. Today we'll be with Dr. Vanessa Menezes. She specializes in child and adolescent psychiatry. The conversation will be great. There's a lot of interesting stuff. So stay until the end. It will be well worth it. And afterwards, we'll even discuss whether Dr. Vanessa will return many more times to share her knowledge with us, and so that we can continue to evolve and make our own choices. Welcome, dear. God bless you. It's a pleasure to be here with you. Thank you so much. I can't even tell you how nervous I am being here in front of you, but thank you so much. Okay? Thank you for the invitation. Thank you for your consideration. Thank you for sharing knowledge. Thank you. Okay, thank you. My audience is yours, Vanessa. Please feel free to stay, and in this 1 hour and 30-minute chat, feel welcomed, cherished, and loved. Understand that you are providing an extremely important service. We are suffering in mental health. And I'll say this, and God is so wonderful. We just returned from an international speaking tour, and I realize this is happening all over the world, and please feel free to contradict me if I'm saying something wrong. Psychiatry in the world is progressing at a very, very slow pace. I think we have a lot to evolve. So easy professionals like you will gain relevance in the market and have a huge space, because we have a lot of work to do to change mental health in Brazil and the world. So, welcome to express your opinions, to talk about what you think about everything you've studied. Your perspective, not only as a psychiatrist, but as a mother, as a woman. Feel welcomed by me. To all the millions of people watching you right now, thank you so much. I truly hope it makes a difference. To those who are listening, to the mothers who are listening, to the families who are listening, Because it's what I love to do. It's what I live in my home, right? So I think it will be of great value. So, thank you, okay? Dear, I want to start with something you told me that moved me deeply about your daughters. And I think that we begin from a very positive place when we start talking about this. You were talking about a gift you brought for your daughters that involved their intervention. And for me, that already illustrates the current perspective on fatherhood, motherhood, and raising children. Tell people a little about what happened in that event you just told me about. I couldn't leave it out because it's beautiful. What happened? Well, since I work in 5 municipalities in total, I travel a lot, right? And one of the trips always involves me stopping, refueling. I always grab a little something. I grab a bubble wand. I grab a little treat and bring it just to say, I remembered you, daughter. And on one of those occasions, I remember I gave a bubble wand to my daughter, Mom, my 4-year-old daughter, of whom I have 2, 1 3, and 1 4. She said, Mommy, I have everything. I don't need the bubble wand. I have bubble wands. I have lollipops. I have everything. She said it in her own way. Now I want you. Then I said, but do you have mommy, daughter? She said, no, mommy, I want you at home. Then I told her, but daughter, Grandma Lou stays with you. And so I said to her, but daughter, Grandma Lou will be with you. Grandma Lou is Luciana, who is a helper we have, granted, who is a mother to me. Granted, who is a grandmother to the girls, and the girls call her Grandma. Then I said, Grandma will fight in my place while Mom is at work. Then she said, no, Mom, but I love Grandma Lou, but I don't want Grandma Lou, I want you. And that changed everything for me, because I thought, my God, they're asking for their mothers at home. They want their mothers with them. I said, so let me recalculate my route. Let me give new meaning to everything I've thought until now. And I said, I'll do it because I do everything for them, right? I can work on whatever. Andrea, whatever. I get home, I go to the trampoline. I go for a walk. Daughter, do you want to go to the playground? Let's go to the playground, daughter. Mommy, I want to. Let's paint. Let's paint, daughter. Let's do whatever. The time I spend with them is 100% with them. 100%. What have you noticed in your practice, Vanessa? And feel free to relax. What have you noticed in your practice and in relation to the parents who have come to you? I'm not even going to ask about the children. I had a theory that I used to say, it's not that I don't like seeing children. I love seeing children. I don't see them because the problem is a little deeper. Because when adults came to therapy, the issues were adult issues, so it was easier for me to work with them. But when children came to therapy, the issues were more systemic. They were family issues. And then it was complex. Because of that father and that mother, they wanted me to solve the child's problem. But they didn't want to get into the problem as a whole. What kind of fathers have been coming to your office? What have you noticed about these fathers who bring these children? I won't even talk about the child yet, because then you're talking about a mother that Winnicott would call a good enough mother. Perfect. We're not. We're far from it. But Winnicott will talk about a good enough mother. The mother as an object, the mother as an environment. The object mother is the one who, if the child needs to eat, has food. If the child needs a diaper change, the diaper is changed. But more than that, the environment mother is the one the child perceives exists, that she is there. When you tell me that you arrive, that you go to the trampoline, you are an object mother and an environment mother, but we won't get into the child yet. What kind of fathers have been coming to your office? I'd say that today, Andre, I've never done this survey, but roughly I'd guess 85–90% of the families that come to me, even without talking about pathology, are parents who are not present and substitute for that presence. That's very sad, very sad. I say that if I could before seeing a child, I would want to do psychoeducation with those who are on the waiting list for me to see. I think that would make all the difference in my care. All the difference. Masawa, like you said, very often they are dysfunctional families. I don't say dysfunctional because just because there was a separation doesn't mean it's dysfunctional, but I think it's a dysfunctional family where the child has no support. One day, the child comes accompanied by the paternal grandmother. Another day by the father. Another day by the mother with her partner. Another day by Kofaf. Another day by Kohanaf. So each day, I have to give a different orientation. I have to do a different approach so that we can bring that family to think that the child is the main focus. And they get very lost in that. Because it's a dysfunctional family. It's a family that isn't present. It's a family that substitutes for various things. Because I'm being very cautious about this issue of bringing a little gift for my daughter. Because I don't want to replace my presence. In fact, it's just to show that I remembered them, right? But there are families that don't do that. There are families that aren't present, and yet they arrive with tablets, cell phones, and computers, and the children are getting younger and younger. And even in more impoverished social structures, says, because you're providing public services. You provide public services. So I'm thinking about a more financially and socially disadvantaged structure. Even so, this substitution happens far too much, way too much. These are families that are very financially disadvantaged, yes. But even in their poverty, even in their precarious situation, they go and buy a tablet for their child to give to a 3-year-old. They buy a cell phone, exchange their phone, and give theirs to their child. Because, oh, it's left over. Call it, doctor. Call it. It doesn't even work properly. So they give it to a 3-year-old child, even in the most impoverished families. Even when you talk about dysfunctional families, if a mother is doing very well, but doesn't have access to healthcare, mental health, and I think that's what we provide here. Hey, B, it's a service. We are democratizing mental health. A woman is watching us in a remote corner, and she hears you talking about dysfunctional families, and she worries. What kind of dysfunction do you consider? This will affect your child. Especially when I see patients in my office. The father and mother come in. A mother come in, and they are separated. And at that moment, when I'm doing a simple anamnesis, something to understand the child's history, the pregnancy, the context, the conflict begins. The conflict starts at that moment. And I'm talking about a hospital environment, and I'm talking about a doctor's office, and even then, the conflict exists. Imagine at home, regarding the child's origins, regarding the parents having conflict between them, arguing in front of me. Oh, doctor, but at the time he made me so angry. I was pregnant. That's why my child turned out like this. I've read that it was something I went through during pregnancy. It was your fault. Then he blames me. And that's how it starts. Yeah, you cheated on me during my pregnancy, right in front of the child. At that point I say, Dad, Mom, let's come back to the context. Let's go. I have to catch them saying, no, let's go back to the consultation. Let me better understand how it was. But did you have any illness during the pregnancy? Imagine what happens behind the scenes, you know? It's happened that I saw a little patient who had attempted suicide, 16, I don't remember if it was 15 or 16 years old, and I needed to call the mother. I said, come to the consultation with me. Then the mother came. Then I opened the phone and said, her father is a bum, her father is like, and in front of the girl, I said, Mom, that's not the kind of language you use with a child, Mom. That's not how we talk, doctor. She has to understand everything. She has to understand the father she has. I said, look at this. I said, look at this. I said, Mom, the conflict you have, you don't have to transfer it to the child. She's a child. Hody. She's a teenager. Hody. She's just graduating. Hony. Hony. She doesn't have the brain maturity to understand all of this. I said, resolve your conflict and don't involve her. But they involve a lot. A lot. A lot. A lot. For me, family psychoeducation had to be the primary treatment before any diagnosis. Because when we give the diagnosis, it's very difficult. It's very difficult. Because sometimes the family takes it as an anchor. Conflict. So, I think that parental psychoeducation is more important than any diagnosis and treatment. Any diagnosis. So, as a psychiatrist, just to make this very clear, this conflictual relationship between the parents, psychologically speaking. Now, speaking as a psychiatrist, not even as a psychoanalyst, even though I hear you talking a lot about this, will this affect their mental health? Absolutely. Absolutely. There's a gigantic detriment. They have no reference point. They are teenagers who have no reference point. They don't have a father figure. Because teenagers, if you speak a little louder, the father gives in. If you speak a little louder, the mother gives in. They will have a reference point, a hierarchy. Like, you have to respect my father, my mother. Something we had, I'm turning 40 now, something I still have today. No, they don't have that, They don't have that context at home. And it's interesting because I see it this way. My parents had a lot of conflict, right? But that was, I think it was even an approach of that generation. They at least tried to protect each other's image in relation to us, even by empirical inference, because they didn't have that knowledge. My mother is semi-illiterate, my father is 8th grade. He didn't know that this influenced our mental health, but he had problems with my mother. My mother had problems with him. But she preserved our father's image. She had problems with her husband, and I saw that in the previous generation, with my cousins, with my uncles, with the people I interacted with. Today it seems to have gone too far, right? Go too far? No, today that doesn't exist anymore. Today they don't have a reference point, they don't have what it means to be a father and mother at home, hierarchy, respect, hierarchy, respect. They don't have it at all. How will psychiatry consider some of these issues? It's even a curiosity. Indeed, because psychoanalysis, especially Winot, who specializes in child psychoanalysis, and Meliclan, will say that the first 3 months are crucial, even for some psychotic ruptures, for some psychotic structures to crystallize, such as bipolar disorder or borderline personality disorder. Psychoanalysis interprets certain movements that occur in these first 3 months as potentially leading to a future pathology that leans towards psychosis. Does psychiatry consider this? Absolutely. It's our foundation. The bedrock of our understanding, particularly when studying child and adolescent psychiatry, is, in fact, exactly that. It's development, clem, of course, physical, clem. But the mental aspect is important to us. This beginning is absolutely crucial. Even in gestation, in conception, yeah, it's very important. A baby in the womb changes everything for us. How was the gestation? When I do anamnesis with the mother and father, when the family comes, I ask everything. Everything. I ask for the notebook. I say, give it to me. No, doctor. Does the vaccine have a specific day? No, I don't want to know about vaccines. For me, the note from the doctor, the note the pediatrician made when they received your child, that's important to me. It makes all the difference. So edu. For me, everything. Everything. From conception, the child, among other things. What did you have during pregnancy? What did you use? What substance? Because it's very common, right? Especially in a society that is more precarious. But very common. Muo, right? Access to psychoactive substances is very common. So for me, that's very important. Why? Very hanat, very hamai. Yes. I say that nothing is by chance, right? Neither good nor bad, right? I say that the small actions of everyday life lead to the result, whether favorable or unfavorable. Yes. I say that I didn't perform any miracles with my children. It was the everyday routine. And it's not by chance. Oh, so-and-so is such a good person. No, it wasn't by chance. It was everyday life. The bad things too, right? Unfortunately. Right? They are the sum of small actions. It's interesting when you say you asked for the notebook. We were in Switzerland, and I was talking to some people. And a woman, a Brazilian woman actually, whom I went to her restaurant, was talking about her granddaughter. I said, "Where's your granddaughter?" She said, "No, she lives in boarding school. We only pick her up on Saturday mornings. And on Sunday nights, the municipal government comes and picks her up again and takes her to boarding school. She stays at home from Saturday morning to Sunday night." Then I said, "But why boarding school?" She spoke for herself. "Because here in Switzerland, it works like this. In the first 6 months after you enroll a child in school, the teachers and educators observe the child, checking their notebook, combed hair, clean shoes, whether homework is done or not. Based on this evaluation of the first 6 months, the government decides whether the child stays with you or not. And then the child is taken to boarding school, and you only have the child on Saturdays and Sundays until night. The government takes care through observation of the basics. Clean shoes, combed hair, the notebook. Whether you're getting vaccinations, because the government understands that the harm of separation from parents will be less than the psychological harm that this child will suffer from being in a house where there aren't sufficiently good figures. There aren't, but this conflict, I see, is real. This is what they do here in Brazil. We only see it, right? We don't apply it. In my practice, I see hygiene as very important to me. I put it in the emergency room. Sometimes I see hygiene is poor. Mommy, who gives him a bath? Me, doctor. I really said that. And it's working. Oh, he accepts the bath. Ho, he accepts it. Ho. And the poor boy smells better. Yes, me, the child, a 4-year-old child. You were talking about a 16-year-old teenager who attempted suicide. Have you ever attended to a child or teenager in this situation of psychic vulnerability where you assessed everything? The family was in a state of amnesia and you said, "This shouldn't have happened." Yes. It has happened, and I realized it. It has happened that I attended to them and saw that they really didn't want to die. It's because everything was very messed up in their little head. Seksad. Everything was unstructured in their little head. Everything was disorganized in their mind, so the way out they found was to try to kill themselves. And the opposite has happened, where you looked and said, "This family is structured. Everything is fine here. And I don't know why this child tried." You can count them on your fingers. You can count them on your fingers. If you hear about it, you can count it on your fingers. Most of the time, it's mental disorganization. Why? Probably the structure doesn't help. And what you said makes perfect sense. Those 3 drawbacks make perfect sense. Perfect sense. Oh no. It's just a baby. Leave it there. What? No, absolutely not. All the development is happening there. Take it out of your bed. My husband is proof. He's here, he knows. 19 days old, and it's our daughter Irene, our baby Elle. Get out of our bed. Does it hurt? Of course it hurts. Who doesn't like me with my mother? What is this? For me, it's my mother to this day. Really? Of course. It's nice, it's cozy, but it's necessary. And the couple? This child falls in the middle, and the structure. It's only 2 months old. It's not even sleeping. No, it's sleeping. It's not sleeping. I don't agree at all. Vanessa, what's happening to children that you think wasn't happening 20 years ago? Even in a world context like this, 20 years ago you were a child, as a teenager. What was your reality like? What did you see in your classmates, in their families? And today, as a doctor in a different perspective, what's happening? What do you see when you think, wow, things are different, everything's wrong? It starts with the hierarchy within the home, something I had, and nowadays we don't. Well, I'm not saying everyone, no. Let's generalize. Of course. Thank God there are still some families I see that really have that, right? They have that foundation we had once, but nowadays we don't perceive that. They don't know what a father figure and a mother figure are within the home. Or mother and mother figures, right? Because each family has a different figure. There are many couples who are affectionate, and that's fine, and who raise their children very well. I have patients who have that, but it's the affectionate kind, and they raise their children very well. But they don't understand the figures, who the child is, and who is the authority within the home. They don't understand. And one thing I'm very picky about in my practice, I take a long time to ask, I first go in, improve, gain the family's trust, is the screen. That, for me, is something that doesn't make sense, Andre. It doesn't make sense, Ani, it doesn't make sense. It's something that, for me, is, it's a gigantic loss. And who's gonna see that? I never get tired of talking throughout the session. I see 4-year-old children who spend 9 hours a day on screens. 9 hours a day. It's understandable that a child will sleep. 12, 13, 14 hours, 9 hours they're on screen. I can't handle it. I can't accept it. I can't wrap my head around it. What is the harm now, as a scientist of the mind, of this excessive screen time? They don't need to interact. They don't need to play. Because they're fed the pleasure that the screen gives them. The dopamine. It's a drug for me. It's a drug. Even better, I talk to clients directly. I think I heard someone talking about this today. They'll have screen withdrawal symptoms. Write this down. Because the child, so much, when they have that phone in their hand, you talk to them, they look at you and immediately look down. Then you speak, they immediately look down. I say, can you hang up just so I can talk to you? Just a little bit with you? No. Then he gets aggressive, reacts aggressively, gets more agitated in the office, you take him out. If the battery dies, my God, get ready, because something is going to break in the office. He's out. You notice this in your office, inside the office. I say, Dad, Mom, this is dopamine, for God's sake. He says, many don't understand, right? Then I say, it's the feeling of pleasure the child has. He doesn't need to play, he doesn't need to talk. He doesn't need to interact, he doesn't need to speak. Oh, doctor, but even the drawing is teaching him to speak, to identify colors. No, he's repeating the colors, right? Yes. Even more so if it's an autistic patient, I would add. He's not learning the colors, because if I ask, this is blue. If I ask, this is blue too. If I ask, this is blue, everything is blue. Because he learned and became familiar with and hyper-focused on blue and blue. So in my case, my point of view goes beyond family hierarchy, because that no longer exists. There's no longer respect within the home, it's the excessive screen time. I argue, and I always harp on this point, I'm a nag at home about it, and I even want to return to this point, because it's a very important one. First, an interview came out last week with one of the WHO representatives, showing how much the hospitalization of children in crisis has increased, which is news. I think it's even higher now, right? Yes? For now, outside of Brazil, the number of hospitalizations of children in crisis, children needing containment, being admitted to psychiatric hospitals, is still higher. You, as a psychiatrist, and now being very objective and effective, if someone asked you, I'm a mother and I have a child, I would say, Doctor, I will obey what you say. Until what age is my child prohibited from screens? In your perception, does this interfere? Well, if we're going to take it literally, for me, children don't have screen time. It's the foot of the lyrics. Until what age? I'd guess up to 12 years old, without hesitation, because of brain maturation and neural development. But I understand everyone's reality. Sometimes I say that I'm quite human, and I think motherhood brought me that after I started working in the office. I'm human, but I'm still strict and talk about limits and rules at home. Masinha lives alone. Is that okay? Want to cook something? Turn on the TV for a little while? Doctor, for God's sake, I can't even cook. That's fine, but you turn it off. You choose, you turn it on. You turn it off. That's fine. 15 minutes? 20 minutes? That's all right. But in my opinion, what's happening goes far beyond that. They deliver the phone. It's the child's. So imagine an 8 or 10-year-old child with a cell phone in their hand. Andre, today I saw a child with an intellectual disability watching sexual content in front of me. Wow. And the mother was right there. and I'm attending to the mother. I was typing. I said, "Just a minute, Mom. Give me the phone." I took it from the patient, looked at it, and said, "Go see what she's watching." "Oh, doctor, it just appeared." I said, "But have you checked with your finger to see what's there?" I said, "Come here with me." I touched it. I take this time. I dedicate it. But it saddens me a lot, because the number of cases I'm seeing in my office is increasing. So, going back to your question, thinking about brain maturation, children shouldn't have screens at all. What are they going to do? They're going to do what we used to do. I mean, play with cardboard boxes, with bottles. They're going to do what we used to do, hit each other in the mouth with a stick, break a tooth, things like that. We used to do that. Today my daughters are playing. She bumped her forehead there. It's all right. I said, children have to have scars. I said, "Do you want ice or ointment, honey?" "Good." She then asked for ointment. I said, "I applied it. All good." My assistant said, "Get a glass of water." I said, "No need. It's all right. It hurts." That's right. The scar tissue is everywhere. It's stitched up. Everywhere. And that's it. That's it. A child has to be a child. I say that screen time is, like you said, you can't be radical, right? Of course, at some point this will need to happen, even for adaptation reasons. But that doesn't justify a certain discourse. Oh, but my child will be very, left out because everyone does it. Well, you're not everyone, and he won't be left out at all. He will create another perspective of interaction. And that's not an excuse. He doesn't need it, kalit it, he will have it, kalit it, but within the limits of what's possible and probable. I say that the limits our parents set were wonderful. I remember perfectly. I studied in the afternoon. My mother used to say, "Hey Andre, you're gonna wake up, do your homework, then you're going to watch Dungeons and Dragons. Bath time is when Dungeons and Dragons ends." Yes. Dungeons and Dragons ended. Oh, you had to take a bath. You'd have lunch, go to school, come back and watch the Yellow Woodpecker show. Then the news would start and say, "This isn't for you. It's not for your age. It's not for children." Soap opera is even less. We'd go play, we'd go to sleep. So there was a screen. You must have had one for sure. You had little things, little animals, I don't know what. We watched it Puatia, but there was a schedule. It wasn't on demand because it ended. So they didn't show 20 episodes of Dungeons and Dragons. They showed one. You had to wait until the next day. It wasn't on demand. The problem isn't even the screen itself. Specifically, I think the problem, what's happening, is the free demand, the handing over of cell phones, the freedom, the computer, the tablet, I don't know. Today a child is at greater risk inside their own room than in Praça da Sé in São Paulo. Much more. At the last Congress I went to, at Breno in Fortaleza, it was perfect. They talked about this. They said, "You have no idea what apps teenagers have these days. You have no idea about some really, really bad things, really macabre things. To tell you the truth, like doing a live stream of abusing a homeless person, setting a homeless person on fire, it gets so many followers, so many likes, things that, my God, we never imagined would happen." So I agree with you. I don't think the problem is the screen, but the problem is that they don't know how to use them. They don't know. The parents seem tired. I don't know what they expected when they had children, because it's not easy. How many times have I blamed myself? I've said, "My God, do I have to quit my job to stay home more? What am I going to do to be with my daughters?" Because the time I spend with them, the time we spend with them, my husband, we're with them. But parents nowadays don't. They prefer to hand them over and say, "No, they're with me, they're on the screen, but they're inside the house, doctor." They have no idea what children are watching on screens. They have no idea. It's all kinds of content. And now even physiologically and anatomically, because you mentioned two words, I think it's very important for our audience to understand. You talked about neural maturation and neural pruning and how screens can influence that. Give us a lesson on that, hangness, so we can understand it in practice and understand what I'm doing. Because people have good intentions, want to do the right thing. What's lacking is knowledge. My people suffer from a lack of knowledge. I strongly believe that when we know, we make better choices. So explain to us neural pruning, neural maturation, how these screens are influencing this. Know us, what we can do differently, in a way that the public understands, right? I say that before the 21 years old, Andrea, we can't. Expose our children to so much of the content we have access to nowadays. Content that we shouldn't have access to either. And we have our brains, though, they're still developing. To put it differently, we are not speaking of a distinct emotional formation, right? From mental health, from physical health. So, 90% of the brain is formed by age 5. Okay? What did you do by age 5? In my opinion, this beginning is phenomenal. We see neural pruning happening at 5 years old, at 7 years old, and again at 12 years old. When discussing brain maturation and the process of neural pruning, it's essential to recognize the key milestones of both maturation and pruning. The child, at that exact moment, has access to information, processes the information, and reacts. There's a point where the child reaches a level of understanding. You can't change his situation anymore. This neural pruning that happens in children occurs around age 12. They've already processed that. In practical terms, faced with this glass that they dropped and their mother yelled at, Bray, they understand that what they did, that they dropped it, that they broke it, will always be something very bad. They understand in their little heads that it will be something very bad. They don't understand that it's okay, they dropped it, right? In terms of experience, that's basically it, because if we're going to use technical terms, sometimes the kind of parents we want to have, we don't. So, I'm with a little child who sometimes witnessed their parents arguing, something we didn't experience in our childhood. And I say that in my family, I didn't see that either. Thank God I had the privilege of not having that in my home. But they understand that in the face of that argument, how will they react? There are little children who, when their parents start arguing, start yelling a lot, very, very much. And the father and mother either shut down or become silent or shout louder than the child holuna, trying to understand who's talking who's going to have the most active voice at that moment in the office. I'm talking about things I've seen in the office. Things they need to do, where the mother or father needs to end the conversation. But meanwhile, the child is already screaming, and each and every time, what happens each time, the child will invariably show this reaction. So sometimes a family comes to the office, approaches me, and sometimes, in a certain tone, the child comes in screaming. And the child has this reaction too, because for them, they understand that way, that experience, kati, and that reaction they had, they will always have. Their little brain can't understand that they need to face it in another way. Their coping mechanism doesn't change. The way they reacted, their reaction to that action doesn't change. Repeating, up to age 5. Even at that age, I can make a big difference in the child's coping mechanisms. I can help them understand many things related to our experiences. After age 5, ikawa, I have about 10% to work with the child regarding their little brain. There's not much left for us to work on. This early childhood is very important to me. Early childhood is so important that I think almost 100% of diagnoses are made during this time. When I'm talking about neurodivergence, when I'm talking about diagnoses of ADHD, autism, I need to see alterations in early childhood. Early childhood is very important to me. So parents, if they can, I know it's difficult and it's not easy in my home. Sometimes the patient says, "No, but you're a doctor." If parents can, review how they are doing things at home. If parents can, review how they are raising their children at home. Easy, isn't it? And it's not easy for me. It's not easy for psychoanalysis coincides with your data and your class. Psychoanalysis also says that from 5 to 7 years old, the story is already somewhat defined. Fine, there's not much you can do. And that's what you call pruning, what psychoanalysis calls a behavioral pattern, right? So, it happened here. I reacted like this. From now on, everything that happens here, I react in the same way, yes. Because I think I understand that it's the same style. That's how they'll face it, that's how they'll have to deal with the situation they're facing. And, that's what motivates me. Because I think, if we can, I even get emotional. If we can intervene so that people understand and please don't make mistakes during this period, that's why I really like the area of childhood. Very, very, very much. Sometimes the mother comes to me, but he doesn't talk. I spoke, but he's more transparent than an adult. Because the child is what? On earth, there's nothing more vulnerable. A child is absolutely vulnerable. They are more vulnerable than an animal. Because an animal is born ready. A little lion bites and claws you the moment it's born. A child is the stage of greatest vulnerability that exists. A child only eats if you feed them. They are only cleaned if you clean them. They only walk if you take them. They only dress if you do. They only cover themselves, so it's incredibly vulnerable. It's like a sponge, and it absorbs everything, the good and the bad. So for God's sake, in those first 5 years, from 5 to 7 years, dedicate yourself. Do whatever needs to be done. Corto will say a lot, right? And I think it's beautiful, right? He talks about getting pregnant, right? That's when the parents get pregnant, right? That the belly grows forward and the parents take a step back, including in their own existence. And I repeat, I think our parents did that very well. I saw my mother sacrifice herself a lot for us. For us, she would say, I wouldn't stay with this husband for the rest of my life, but for my daughters, I'll stay because they need a father. So I saw my mother take that step back, and I think that's what's missing in parents today. Take that step back. It's only 7 years, basically. It's only 5 years. So avoid everything you can avoid. This marriage is awful, just a little bit. Please breathe. I'm saying life expectancy has increased a lot, right? Thank God. We're going to live a long time. God willing. In the name of Jesus. Hoke. It's only 5, 8, 7 years, 12 years, fall. That's all you need. That's all. Then you'll help them move on. When others move on alone, everything is fine. It's a time. It's only once, and it doesn't come back, right? It doesn't come back. There's no way. Childhood is once, and it doesn't come back. Then you have a whole existence to live adult life. But childhood doesn't come back. And then, we're human beings. We get tired. It's tiring, Mom. It's tiring. I'm tired. I remember when I was breastfeeding, sometimes I'd say to my husband, just hold on a little bit, let me go to the bathroom. Sometimes I'd sit on the toilet and say, Jesus, let me breathe, let me come back, okay? Let me come back, and there's a little being waiting for me. My dream has always been to preach. I said, let me come back, and it won't pass, you know? That I'll take away, your hope won't pass. My mother says, my daughter is 19 years old. Bia is studying medicine. She passed now. Thank God. Today she arrived from college, and she's downstairs at my house having lunch. Then she shouted, Mom! And I was getting ready to come. I said, hi, my daughter. Come stay here with me for just a little bit. It
won't pass. Not you, forget about that.
But I think that this breastfeeding phase really takes a toll on you, right? It's very nice, but it's very draining. Physically speaking, thank God, I had a husband who helped me a lot. He even cut pizza next to me so I could eat and nourish myself while I was breastfeeding. Go for a walk, go to the park, go for a walk, go to the square, take a breath and come back. Sometimes I tell the mothers, Mom, leave it to your mom, go get your nails done, go get your nails done, go for a walk. He goleming, go to the park, he goleming. Take a breath and come back. Okay, just to give yourself time. I remember a podcast I listened to with you and Ana Beatriz Barbosa talking about this. It's just to give yourself 90 seconds to breathe. Breathe and come back. It's tiring, but it's a very short time considering we have a life expectancy of 80 years. Anyway, it's very short. Very short. And I say this, right? I understand everything. Oh, my marriage is bad. I work all day. I arrive stressed. I still have to cook, clean the house. There are so many motivations, and we are sensitive to all of them. But we still have to take a step back.
Yes.
Despite your situation being difficult, even in the worst circumstances, you still possess more resources than that vulnerable individual. Much more. So, take a step back. It's only 5, 7 years. Physical, emotional resources, right? You have much more mental capacity than a little child. A child is not to blame. I say a child wasn't meant to be born, but brought into the world. Let's go. And a question I also ask is, was this a desired pregnancy? Yes. Did you plan this pregnancy? No, I didn't plan it. But you followed up, did you get prenatal care? Yes. Then I accepted it. So, for me, that's different too. Does it interfere? Yes, it does. Even today, thank God there are few cases, but you didn't plan it. Yinjo. And it's not well accepted even today. Has it happened? It has. There are people who verbalize it. Verbalize it. On many occasions, I refer people to a psychologist for support. You know, I was still commenting on this at reception. There was a mother I saw who had attempted suicide 4 times in a week. But it's a very, very serious case, you know? And we needed to refer her because, oh my God. Then I called, how can a child like that have mental health? Right? They don't. If the mother herself doesn't want to live, they don't. You could see the suffering, you know, in her eyes, in her asking for help, her pleading for help. I ask, and did she go to get it? Or the child? The child. And the child had what? Autism. And it's a very advanced level. And there's an associated disability. Nom, it's very, very severe. Dog, it's very serious. Very. He aggressively attacked me. right before my eyes. And I'm very much against medicalization there. We have to be firm. Right. Her ail, because there isn't much else, we have to restrain her. What do you have to use chemical restraint? Thank God she accepted it. She went to the appointment this week. She said, "Doctor, I'm receiving treatment at CAPS, Psychosocial Care Center." She told me. I said, "That's good." I told her. I stayed. What a blessing that it worked out. She said, It's the moment I have to breathe, to do therapy, which is intense. Yes, I imagine. Happy holiday, the mother says. But a holiday from what, doctor? It's intense. It's because for her there are no holidays, right? Although I say that, Vanessa, we are living in a moment of such a large number of diagnoses. Right? So many diagnoses. Has science evolved? Has psychiatry evolved? Or are we just finding it easy to diagnose? Because, it's not possible that there are so many autistic people and so many people with ADHD. I mean, it's not possible in my ignorance. Maybe it is possible, but the sheer volume is gigantic, and the precocity of these diagnoses really scared me when I was in my practice. I had patients who went to the psychiatrist once and already had a diagnosis. So, that was quite frightening to me. Who am I, right? I'm not anti-science, and I'm certainly not going to question other areas. Who am I to question a psychiatrist's diagnosis? But the methodology and the way these diagnoses came to me was very frightening. Have we evolved a lot in our ability to diagnose? Or is there a gap there? There is a gap. There is a gap. It's not a small one. I say that we have to be very careful. We have children who really do have developmental delays. We have children who have a delay. We have children who have nothing wrong with them, but the mother comes with a little book she found on Google and says this, that, and so on. And the child, completely different, tells you, "Just a minute, Mom. Let me grab it and take it to the playground quickly. I'll be right back." And what I really like to do is in my office. When I call the family in for an evaluation, I was talking about this the other day. My husband said, "Tell Andrea this. She'll like to know." I sit with the child. "Dad, Mom, sit down for a second." I sit with the child and we play. There's a little time when I play. After I've played with the child, then I say, "Now you stay here. I'll be right back." Many times the child comes and puts a toy next to me on the table, puts it next to me and comes over. Then I say, "Mom, let's talk a little bit now. Tell me a little about the context." Then I really begin the anamnesis. So, for me, I see the patient outside of that mother's context. I get a lot of mothers who want to benefit from this. Let's talk about a few points, shall we? Let's start by listing some points. There are mothers who want the benefit of this. I have a child who really has the disorder. There are schools that demand a diagnosis, and I'm talking about both public and private schools. They demand it. Hey, they really want to see the student if they have a diagnosis, and I fight for this a lot. I even call people from the education department. Let's have a meeting. Let's schedule a meeting between health and education so we can understand the context. I'm not going to say I know everything, because the fact is, I learn every day. Thank God, every family teaches me, every child teaches me, every story teaches me. But I get a lot of diagnoses that I don't agree with. And I don't agree, and I don't sign them in any way. For me to give the diagnosis in a single consultation, a picture from a book would have to come in front of me. Otherwise, it doesn't work. No, it doesn't work. The child, as I said, even if nonverbal, is very transparent. Well, her play tells me a lot. A lot. That's why I like to play with the child and then talk to the parents. It tells me if she really understands the matching, that the cup was made for Pyrrhus. Does she understand that that little piece was made to fit into that shape? The child shows me this, demonstrates this, and there I perceive the issue of color identification, of animals, and so on. I encounter a child at that point who, on occasion, struggles to grasp this concept, consequently hindering their ability to engage in play. I give her a little keyboard. She turns the keyboard upside down and starts looking at the keyboard. I take a child who doesn't know how to play. We have to teach her how to play. But then I'll assess the environment. Does she really play at home? Does she really have parents who sit on the floor and play with her? Oh no. Parents work all day, okay? Who does she stay with? Okay. Live with grandma or not at school. It makes a difference, you know? A child staying with her grandmother with the television on all day. The difference is that with a child who stays in school, well, I'm absolutely not in favor of putting them in school too early. I put mine in crying. My husband knows. Crying. I cried for 14 days straight. But I needed to go back to work. But for me, it's better than leaving them with a nanny who turns on the TV inside the house and with the grandmother. So if the parents can help, they can lari. Does the child not know how to play because they don't understand play? Or because they haven't been stimulated? Does the child not know how to speak because they really have a speech delay? Or because they haven't been stimulated? But do you play with your child? What do we play? Oh, I'm like a cat on the floor. He climbs on top. We play horsey. No, Dad, come here. Let me teach you how to play. Come here, get this toy. Many times I call the father to play along, to teach. At this moment, there is a connection with the parents. It's in that moment that the child learns. In play, you say, "Ah, this is green." Repeat with a green mother. Ah, it's nonverbal. But try a visual contact. I have mothers who I tell to put on red lipstick to talk to their children. Bring the object close to your mouth. Bring it here close to your mouth and talk to your child so they look at you. No, so they understand. So there's the diagnosis, going back to your question, but there's the diagnosis that, I won't say it wrong, it's difficult for us to get into the ethics of a colleague, right? I think this is very delicate. And when I take the side, I tell the mother this. But I understand that you have this recipe that has several diagnoses, several therapies, VANESSA. But I don't agree with everything. This one I don't agree with, this one I don't agree with. I think we have to evaluate again. We have to stimulate. Let's start therapy. Why does the team talk about this? Because it's very easy for me to have a child at home who isn't stimulated. They have a delay. I arrive at the office with a single consultation, and I've already seen online diagnoses. A single consultation, a 3-year-old child with 3 different diagnoses. And when I talk about ADHD or other disorders, what we sometimes need is a different approach because there's an excess of energy. I'm not just talking about autism, which is a matter of social interaction. I have to be careful about the age when making this diagnosis. I can't say that a 3-year-old child has ADHD. The literature, folks, 80, doesn't talk about age in relation to ADHD, but it does talk about brain maturation. How can I take a child who's in the phase of exploring everything and put a label on them, and then the mother crosses her arms and says, "No, he has ADHD. The boy is just melting here in your studio." No, that's not how it works, Mom. He really does have it. He doesn't have it yet because he hasn't even finished processing the complete brain. I don't close a diagnosis before 6 years old when I'm talking about this excess of energy. Because, as we said before, if the neural development hasn't happened, it's not time for me to talk about that. Autism is different. Autism can be detected quite early on. Yes. And the earlier we detect it, the earlier treatment begins, the better the prognosis. Much better. Autism, medication is rare. For some symptoms, VANESSA, move on to sleep disorders. If there really is a sleep disorder. No, doctor, he sleeps at midnight, 2 a.m. But sleeps with whom? With his father and mother. Is there a TV in the room? Yes. Stay tuned. He won't sleep. Especially because I'm going to explain this question better. Because I notice this a lot in the office. Anxious parents, especially parents of children with autism spectrum disorder, anxious about medication. I used to say, there's no medication for autism. There's medication for symptoms. Some symptoms. And then, when medication is introduced in the case of autism spectrum disorder, which symptoms would it be for and in what situations? Because sometimes the parents have the illusion that this child will become quieter, will become more, with the promise now from the pharmaceutical companies. Thank God there is medication that has come to help. Manahia. But we have to be very careful with everything that comes out on the internet. Manahi, very cautious. With the promises from the pharmaceutical companies, we think that we'll give the medicine to the child. It will go into the womb, and a different child will come out. One day I used these words in a consultation, and my daughter cried in front of me. I said, "Jesus, did I go too far? Let's start the medication, my daughter. But I want you to understand that the best treatment is inside your home. I need you to understand what we're doing with you here, so you can replicate it at home. You know this management we did here just now? He wanted that cup." I say, "No, then come here. Auntie will show you a little cup. Let's go outside, so you can see a toy car that I'll show you. This management has to be done inside your home, because if a crisis occurs, it's difficult. It's difficult for the mother to control it. She gets hurt. It's difficult for the child to control it. He gets hurt. Burst, it's very difficult. But when I get a special mother who really wants her child to develop, it's beautiful to see. It's heartbreaking to discharge her, because I say, my God, you are an example. I've already said this. There are mothers I've treated who, if they watch me, will remember. They are exemplary mothers. I say, Iko, you have to give lectures because you have the authority to say that you helped your child develop, that these mothers and fathers need it. I used to do this in my office. I would say, no, you need to be in therapy. Otherwise, I can't treat your child. They need it. I think they need it even more because it's not easy. No. Right? No. 1. VANESSA, ADHD goes through the same perspective. Medication will act on the symptom, not the disorder. So with ADHD, we already have the neurological issue, right? BEAS, we have the issue of adrenaline. BCs, we have the issue of the release of adrenaline and dopamine in the brain. which I need to regulate with medication. With ADHD, given a correct, precise diagnosis, medication becomes a little more necessary in some cases. What case? When I have impairment. If I don't have impairment, why would I treat it? It could be ADHD. Adults don't have any impairment. Impairment is totally functional. They work well, they live well. Hey, everything's fine. I need medication. I'm sure you'll seek a diagnosis, and you'll say I have ADHD. I say, but everything's fine, everything's fine. It even helps me. It empowers me. Exactly. There are people who are functionally like that. Now, where I see the main academic impairment is within the school. Because nowadays, for schools, the vast majority of them, it's, this child is quiet. He doesn't cause trouble. So plug in. If the child is a little more restless, oh mom, do you have a diagnosis? Look for a diagnosis, look for a solution. Let's start medication. Are you giving the medication correctly? This pressure that the school puts on. Sometimes I just need to, look, come here son, come here, sit here. Let's learn. Mom, are you studying with your son at home? Let's regulate the child. No, he comes home, turns on the screen, studies, does homework, 300 things at the same time. It's making the boy's ADHD worse. I help mother in this context. So really, she needs the medication, let's go in. I try my best not to go in too far. But I've already had younger girls who ask me for it, Andre. Yes, I've already had teenagers. Not too long ago, doctor. I just haven't started, because I told my mother I wanted to come here. Nitwe, but my mother already bought it without a prescription. People think Venvin, Liberia, is going to work miracles. Yeah, it will. That's what they think. And it will. Of course not. Of course not. Wow, I'm totally against it. It's the very last treatment option I have, because, I even joked about it here in the studio. The guys say, oh, I'm very agitated, Andre. I think I'm going to take a van. Yeah. I think it's Mila that will transform a person's life. Liberia and so many doctors writing about Liberia for weight loss. I understand. Which, by the way, is a new phenomenon, right? Yes. Have you noticed this? What's the association? And then the convenience arrives. They say, oh, I'm already taking it. Whoever prescribed it. The endocrinologist. I say blood. After, because we lose weight. It inhibits appetite. All of them. Fix it. They inhibit appetite. We forget to eat. I have little children who are sometimes so malnourished and underweight that I have to ask them to give it to them after lunch, because if I give it to them before, they don't eat. I've had about 8 patients in my office who were using the slimming pen, and along with the pen, the doctor prescribed Liberia. And let me tell you, and to stop, they send you to a psychiatrist. I can't handle it because it's addictive, Andre. It's addictive. Ooh, addictive. It's real. It's a drug, you know. It's derived from cocaine. It's an amphetamine. Well, I don't have it. I tell these kids here, for me it's the last option. Last treatment option, especially when I'm talking about teenagers and children. Last option. I never resort to it. For adults, I already start with Ritalin. Imagine, for a child, the velocity, it's way higher. I always gradually increase the dose. I try Ritalin, short half-life. If that doesn't work, I go for the fixed drug. But I try another one first. And if that doesn't work, even after gradually increasing the dose, I start with L. Is the addiction psychological or chemical? Chemical. So the psychological part is also because they like to feel good. But the chemical part is real, you know. It's a drug. Legalized. Are you hearing that? Are you listening? It's the doctor speaking, not me. It's chemical. Come on, legalize all this. All this, kids. Everyone goes crazy with it. And the similar drugs? All of them. And the similar drugs? All together. How crazy. Yes, the usage is indiscriminate, and people are buying it without a prescription. Oh, that's the easiest thing to do. That's the easiest thing. When does medicating a child stop being about care and become a resource, especially among parents? Mainly regarding sleep. They come to me a lot with sedative medication. It's a demand I see a lot in my practice. Doctor, I just need to sleep. That's all. I can't take it anymore. Then I advise on hygiene. But I'm not into sleep hygiene. The environment also interferes for me. If it's really necessary, I try to help. But to give you an idea, even in that, I proceed with caution. I even look for supplements rather than medication. But they seek them a lot, especially regarding sleep. I believe that sleep deprivation is really bad for everyone. When we don't sleep well, we think, oh, I didn't sleep well. Wow, my head hurts today. I'm going to say this. It's terrible. A child doesn't say that. A child doesn't know how to verbalize it. She doesn't sleep well. She's more agitated. More aggressive. That's it. I would say that before the diagnosis, there should be a checklist, right? That the psychiatrist says, this is the checklist. First, you do the checklist. Exactly. You do all this. Then, after you do all this and nothing changes, walkie, then we'll consider the possibility of a diagnosis, right? I agree. Make sure you have bedtime, feeding time, established authority in the home, affection, and dedicated time. Do this, come back in 2 months, right? And if it continues, Kiori, we start to consider the possibility of a diagnosis. And that would be so important. I feel it'd drastically alter the scene. You see? It would reduce so many diagnoses, so many what-y. And how do you do that with your posture? So, I don't even know how I would define it. But so human. Tough too. No. On the contrary, of such a humanized psychiatry. How do you do that in a public service? Because that's the question for me. Because, like you said, you sit and play with a child. How do you do that in a public service? Thank God. Because you have a score, right? You have to meet number X. Yes, everything. It's a company, right? It's a company. Company. Thank God, in the 2 public services I work for here in Uberlandia, I have this freedom to spend more time with a child. Outside of here, what is more time? Do you have an hour? An hour with the child. An hour. 50 minutes or an hour? It depends on the 2 services. Outside of here, I'm fighting to see if this works out. Because for me, time is very important. Only with the parents giving half an hour. So I need at least 15 minutes with the child to play with the child and really relax. Take them out of there. Take them to the playground. And since there's a structure set up to care for neurodivergent patients, I have that freedom there. Right? Occasionally, at the park. I see another CES hospital nearby. Here in Uberlandia, some hospitals have playgrounds for children. There are 3, but I work in two reference centers. One is called the Reference Center for Cruciate Disorders, and the other is the Municipal Campus for the Care of People with Disabilities here in Uberlandia. Wow, how advanced. Is this municipal? Full? State? Federal? Municipal. It's public. Wow. Congratulations, Uberlandia City Hall. Uberlandia City Hall. It's beautiful. Seriously. I still get to know the most beautiful thing in life. At work, they give me the freedom to spend more time with the child. And even with more time, I can have a second, longer time, a third, longer time. I'm not obligated to make a diagnosis after the consultation. I even think, that in private practice, I have this experience too. I even think about private practice. Hey, if sometimes the colleague doesn't feel pressured to make a diagnosis. Well, those who know me know I'm not like that at all. I'm the same in the public health system and in private practice. I am not going to close a diagnosis because I am in private practice, or because I am in the SUS in any case, because someone has been trying to coerce me that it happens. I just want you to fill out the IPVA vehicle tax form. I just don't want you to fill out the IPVA report, because there are a lot of benefits. Exactly. I'm very careful about this. Yes, so, in the public health system, here in Berlandia, at least we have this autonomy. Outside of here, we're fighting to have it. Right? But this time is important for me. In the evaluation, it's very important to evaluate the child. And the conversation with the parents is very important. After all, it's the patient. Right? I'm not evaluating a recipe you found on Google, and the father wants to die. Right? If he leaves without a prescription and without a diagnosis, he wants to die. Many times, they are aggressive. There have been times when I've had to call the coordinator. They sent a message and said, "Give me support here. I'll call security." Because there have been very dangerous situations. Vanessa, what about the child being born anxious? I don't think it's born that way. I think we're the ones who make the child anxious. I don't think so. We're the ones who make it so. Yes, I have this theory. But, doctor, he's so anxious. I said, okay, but it's because we tell him we're going to travel today, in a week. He's been asking me every day. I said, just don't talk. Are you creating anxiety in your son? Just don't talk. Pack your bags. Son, we're going on a trip now. Let's get in the car. That's it, it's over. I don't know if that's even anxiety, right? Of course not. It's something. I say that the best part of the trip is even the anticipation. If you tell me I'm going on a trip in 30 days, I'll think about the clothes today, the places tomorrow, and the schedule the day after. That doesn't mean it's anxiety. People also give too many labels to things that aren't apron. And at some point, that also becomes a problem, right? For example, oh, so-and-so is a narcissist. Oh, you fluctuate too much. You're bipolar. Bipolar. I hear that too much. I hear it too much. Even children. No. Teenagers. Dr. So-and-so said I'm bipolar. I said, why? My mother says that I wake up fine. Then out of nowhere, I get all worked up. I really did say that. No, but that's not bipolar disorder. Don't worry, we'll talk about it. No. Define bipolar disorder for us. Bipolar affective disorder. Speaking of diagnostic criteria for bipolar affective disorder, we have to have a mood swing for a period of time, not just during the day. What is? I don't wake up in a bad mood, and then something happy happens during the day that makes me happy, and everything's fine. I wake up happy, I get stressed during the day, I change. Honey, that's mood swings. Anyone has them. Everyone has them. We women, especially, have them. I have to have at least a period of time of change in that mood. You're depressed. How many days were you depressed? Did it suddenly turn into that? You're too happy? Too euphoric? How many days were you like that? What happened during that period? What did you do? What was your reaction? For me, that's important to evaluate. We've made a diagnosis, now it's mood swings. He's bipolar, he got sadder, more depressed, too many mood swings. He can't talk to anyone. No, I've already had too much. Yes, he's intolerant to fabrics, to labels, ma'am, he's autistic. He doesn't like to eat red sauce. He's autistic because he has environmental selectivity. No, people, autism is much more than that. Joke, the day I went to Villela, he said, "Oh, because my son doesn't like almost anywhere. My son is a bit antisocial." I said, "Villela, I don't like almost anyone. I don't like going to a lot of places." "Why is your son forced to go?" Imagine, "Ooh, people are really extremely boring. I don't like the vast majority." "Why is my son forced to like them?" He laughed and said, "Really, me neither." I said, "That's autism." One week we were cycling, and for a few moments, I was away from the group. I said, "Wow, it's so nice to cycle alone." I said, "What peace of mind." I said, "Okay, if someone sees me, they'll say I'm autistic." Thinking to myself while cycling. That's it. I was talking to my psychoanalyst today. I was in Rome, and we were in front of the Pantheon. We ordered coffee. I said, "Guys, I would be very happy here, 8 hours alone, but I would be very happy." You know that feeling of low? Like, it's not that I don't need to exclude myself, but like, oh, I wouldn't need anyone here at this moment to be happy? Yes. What's the problem with loneliness? What's the problem with not liking some things? What's the problem with having low social skills? Yes, all of this becomes a diagnosis. They want to label everything. They want a diagnosis for everything. I want a diagnosis for everything. Vanessa, you're the specialist. And I'll say it again, and now I'm even going to ask my audience here. We're going to promote Dr. Vanessa. Please follow Dr. Vanessa. I don't know of a psychiatrist specializing in children and adolescents as competent as she is. She will shed a lot of light on much of the work we've been developing. And for those of you who follow me and are interested in this content, follow the doctor. Padim, she's wonderful. She's fantastic. If you need a child or adolescent psychiatrist, a specialist, because the vast majority of colleagues see patients out of necessity, but they aren't specialists in children and adolescents. It's difficult to find a psychiatrist specializing in children and adolescents. Dr. Vanessa is a specialist. So, if you need a psychiatrist specializing in children and adolescents, look for the doctor. All her contact information will be here. If you have or know someone who needs a child suffering from some situation, needing a diagnosis, an evaluation, or some disorder, follow the doctor, recommend the doctor. It's a public service we're providing here. Because I think good things need to grow. There are many unsuitable people occupying positions they shouldn't be in, so we need to give a platform, visibility, to those who have something to offer. And Dr. Vanessa is that person who has something to offer. So I want to ask all of you in my audience to support Dr. Vanessa. One question here, Vanessa, that comes up a lot. Is it possible to diagnose psychopathic traits in a child or adolescent? Because this subject is so delicate, so controversial, and so widely discussed. Right? Yes. We were talking about that. Unfortunately, I see some traits in some children, not very early on. It's not a child who is a little naive. They already show some traits, but it becomes more visible. Between 7 and 12 years old, it becomes a little more visible. I don't say psychopathy. I always walk that fine line. I always start by talking about a defiant individual. Someone
with that feeling of revenge. Then I go more towards the one who actually does evil, disobeys an order, which is more on the behavioral side, a behavioral trait, before talking about the social aspect.
I always go that way. There's a line there. But I always tell the family, I need you, When I talk about oppositional defiant disorder, it's not about children disobeying. What child doesn't disobey, people? For God's sake. You think my daughters are beautiful, right? That I say no, and they cross the street. Okay. Oh, okay. So it's not about that. When we really talk about a feeling of revenge, when we talk about a feeling of doing evil, of hurting, of breaking rules, of mistreating animals, that happens a lot, unfortunately. Then I have to open my eyes to society. It can happen, but in adult life and children, it shows signs. The management and the environment interfere in the conduct and evolution of this case. Tell us about a situation you've seen that you looked at and said, this little child I attended to. It wasn't here in the municipality of Uberlandia. That I turned to the grandmother. How old was she? Age 10. I told my grandma, Grandma, Return him to his father, hand him over. Because this won't work. The father, however, in certain situations, I believe, if I don't tell him he's deceiving me, it's because he was a drug user, and he lived with his paternal grandmother. And the grandmother, in one situation, said she had a headache. She even asked to speak to me, to separate them. Then the little boy said, I won't let you. I'll get water. When she went to drink water, she smelled something. I don't know what the boy put in there. She suspects it's the medication he takes because he was taking medication. She said, Doctor? Did he want to kill me? She was scared. She was even trembling all day, poor thing. Then I said, Give him up, Grandma. You won't be able to handle it. Because she didn't have control over him. Cool size, she didn't know how to manage him. Cool size, she couldn't deal with that situation. So she was harming him. Because she was very in charge. Second now, she didn't have authority in the house. Second now, he did whatever he wanted. I said, This boy is going to torment his grandma. The staff had already talked to me, saying, Look, he has behavior that isn't very good here. When my grandmother told me this, and thank God, she passed it on to my father. But it's a very frightening situation, isn't it? For the boy to have the coldness to put medication in a glass of water, saying he'll get her some water to help her head feel better. And what medicine did he put in there? How much? With what intention? He had the coldness to ask, I'll get you some water. My God, she's a 10-year-old child. It was premeditated. It was premeditated. When my daughter was 8 in school, she had a classmate who had Down syndrome, and the teacher always asked for a pair to accompany the little girl when she went to the bathroom. 2 classmates together. I even thought the interaction was cute, the way the school handled it. And then my daughter came with a complaint, saying, Mom, so-and-so, who was the classmate who accompanied her one day when she was paired to take care of her friend who had Down syndrome, so-and-so who accompanied me today in the pair, can you believe that? At the time that she went to the bathroom, she later wanted to drink water. She got water from the toilet and gave it to her mom. She said that every time they were paired with her, she would always take water from the toilet and give it to her friend, maliciously. So I said, daughter, talk about this at school. This needs to be reported. And it was, it caused a huge problem. Later, even the mother of the little girl, who has Down syndrome, contacted me, thanked me, and said, Hi, I want to thank you for your daughter standing up for herself. And the girl who took water from the toilet and gave it to her classmate in Otiva, speaking to the principal, said, No, I don't feel sorry. I don't feel pity. I did it because I wanted to. I don't regret it. I will do it again if I get the chance. And many times they are docile, you know? You talk to them, they are, she was skeleme. She was super persuasive. Oh, she was friends with almost everyone in the class. And they say, No, you're so beautiful, you have no idea. Things that are shocking. You say, My God, how does this child have the capacity? And they do have the capacity. I don't doubt their capacity at all. Nowadays I see this reality, right? It's not very common. Thank God, it's not very common, but it exists. How crazy. Yes, it's very difficult for us to deal with this, and society doesn't know how to deal with it. Doctor, I need treatment. I need you to prescribe treatment for this little fan. There isn't, Grandma. There isn't a treatment. There isn't a specific medicine for this. There isn't. I can control the impulse a little. But the family environment has to do family psychotherapy to deal with that person. How to deal with it. There have to be rules. There have to be limits, which there aren't. Most of them don't have them. There are no rules, no restrictions. Sleep whenever you want. Do whatever you want. D, sleep at 4 a.m. Wake up at 6 a.m. Eat whenever you want. Eat whenever you want. Don't want to eat. The, don't eat, wait, the, go ahead and grab a snack. Not that we're going back to the beginning. Heat, it's required. Heats, it's not. No hutta, absolutely not. The conversation is great. You who are watching us, comment below, hashtag, if you've made it this far in our podcast. And if you want Dr. Vanessa to come back, put hashtag bring back Vanessa in the comments. The topic here could last 3 days. I'd have roughly 200 questions to ask you and my audience and my viewers as well, I can promise you. Because the topic is quite wide-ranging. So if you want Dr. Vanessa to come back, Mooney, if you want to hear more about child and adolescent psychiatry, hashtag bring back Vanessa in the comments. Vanessa, at the end of our podcast, see, he doesn't call for the couch for nothing, right? My guests are seated on the couch, so I always ask 3 personal questions, focused on the person, Puni, not just on the brilliant professional that you are. The first one is the following. I say that we, the healers, those in healing and caring professions, really this speaks a great deal about our own needs for healing, doesn't it? About our own pain. Nobody chooses what we choose for no reason. I think, for example, medicine. You studied medicine. You had the opportunity to choose 200 specializations for 200 reasons. One that pays more one that allows more rest, one that I don't know what. You chose psychiatry, and then you went a step further. You even chose child and adolescent psychiatry. What does that say about your childhood and adolescent pain? Well, thank God. Thank God there isn't so much pain. But the need to help, especially after I became a mother, changes everything for me. I so much want to be able to help, especially in early childhood. If I could choose Andre, I'd say, my God, I'd take the little girls before they turn 5. I'd say, come here, let's do some psychoeducation. Let's form a group. Because, for me, that early childhood determines the future. So whatever I can do, whatever I give my all to help, to make a difference. If I work with 10 families, if 3 change, for me, that already makes a difference. If 3 say, I'm going to do what she's saying, I'm going to listen to what she's saying, I'll try. At least try. If it goes wrong, at least I tried. For me, that will make a huge difference. A huge difference. Then, more about your maternal issues, right? Very much so. I guess it's because I've always wanted to be a mother. So, whatever I can do to help other mothers. And if we hold hands, let's walk together. Because we're not perfect. I'm not. I make mistakes too, right? But whatever I can say, let's go together. Let's hold hands. I'll help you be a mother. You help me. You teach me. And I'm here for whatever you need. I will do everything I can. What is the biggest frustration in your work today? In your profession? So, in your daily work? Do you say, wow, this frustrates me. It's difficult to say this word, but the diagnosis that isn't happening with that child. Because many families get this diagnosis and don't just want the diagnosis, they don't really want the child's well-being. So they look for professionals, and the professional doesn't even see the child. Sometimes they don't even evaluate very carefully and just put a label on me. That's it. That child will have a label for the rest of their life. I say in the office, careful people, there's no need to rush. So, wrong diagnosis, excuse the word, but I couldn't find another similar one. But the wrong diagnosis is the biggest frustration I have nowadays. I see that it's not the life they're talking about. They're talking about something else. Something less about that child who's in front of me. You understand? They describe something else, and many times I pick up the phrase, let me read the phrase from here. Your child does this, your child does that. I don't agree. I get sad. I get sad that the family has already become attached. The family even comes with tattoos. Tattoos. Oh, they come with necklaces, with name tags. It's very difficult. And to demystify this, but what can I do? And there are advantages, right? There are always gains, right? For me, this issue of advantage is very difficult because they use this to gain an advantage. They want a diagnosis to have a desire. They don't think that it's a life that has received a label. They don't think that. There are, not all of them, I repeat, of course, but the vast majority. This saddens me a lot, you know? Now, forgetting Vanessa the mother, wife, professional, psychiatrist, Vanessa the person in essence, what is your biggest dream? To have a clinic for the treatment and support of autistic children, a clinic where I can choose my team, you know? Where I can have all the professionals to support the family and the child. Autistic children, children with ADHD, intellectual disabilities. There are many, but they don't have the support they need. Neurodivergences in general, ODD, which they don't want to treat. So I wanted a clinic where I could provide support, where the clinic would communicate, where I could talk to the nutritionist, where I could talk to the speech therapist, where we could have meetings. Let's discuss this patient today. Let's discuss that patient. That makes all the difference for me. My love has dreams, and the best I can do in life is build this life here. She could dream of being rich, traveling the world, seeing her daughters get married. She dreams of serving humanity, right? That's why she's here. Honey, I could talk to you for 200 hours. We have so many questions, both me and my audience. I was talking to my husband, and the word ignorant has become pejorative, but it's not. I love to ignore. I love not knowing. Because when we don't know, we have space to learn. So I'm absolutely humble in ignoring some things, and I ignore countless things regarding psychiatry anyway, and I would love to learn from you. I could spend hours interviewing you. Go ahead, put #BringBackVanessa there. I would be delighted to bring her back. She adds to our mission. She adds to our life's purpose, which is to bring mental health to those who can't afford it, to those who can't go welly, to those who can't get to the office. This podcast will reach thousands of people who would never have the opportunity to sit in front of you. People say, Andre, Why did you stop seeing patients? I could comfortably stay at home, charge exorbitant fees for sessions, and live well off of that. But I would only reach a limited number of people. I can't do that with what God gave me. With the gift, the present that God gave me. So, yeah, and I see that a lot in you. It shocks me when I ask you about your biggest dream and, by free association. You bring up this clinic, right? You could do it anywhere, right? I want to thank you. Thank you for the opportunity. Thank you for sharing, Koni. Thank you for the recognition. Thank you for your humility. And so, thank God, I had the opportunity to meet you first outside of here. So it's Andrea, exactly that. The Andrea here. She's outside. She's a human being that I admire very, very much. Yes, I'm not playing a character. Thank God for the person and the professional. And I just want to thank you. Thank you very much. Thank you for God using you and putting you in my life. Thank you. I appreciate you. I'll say this. I'm sought after today by leading professionals, artists, very important people. But I don't choose people that way. That's definitely not my selection criteria. It was at a social event held at the home of a dear friend of mine that I met VANESSA, a friend whom I adore. And when I started talking to her, when I started seeing her with her daughters, with her husband, I said, I need you on my podcast. That's how I choose people. I don't choose based on any other criteria. I don't fight my intuition. And when my intuition tells me, I say, it's this, and it's like this, and it's something that goes beyond that. Looking at it again, it seems to me that the final question was the most shocking of them all. I really like to help. Your missionary sense is something beautiful, very much so. Really like to help a lot. Those who know me outside of here know that. It's mine, it's mine. It's true. It's me. And of course, I say this in my practice. Love doesn't fill your stomach, right? Of course not. We have to think about everything. But what I can do, what's within my reach, I will do to help you reach the knowledge, to spread the knowledge to everyone, to make sure everyone has access to the knowledge of mental health. And I, God willing, regarding children, I have a great desire to help and demystify what I think has become a very big part of the culture. Right? So, we have to stop there. Let's go back. Let me see my daughter. Let me really understand what a child is like. Does she have a diagnosis? Yes, she has diabetes. Everything is fine. But she's a child. She's not going to stop being a child. We're not going to label her in any way. We're talking about life. We're not talking about a piece of paper. So, for me, this makes all the difference to an entire existence. Right? Because a stroke of the pen now determines the rest of her life. The future. So I don't agree with that at all. And whatever I can fight for and help. Those who really need it, I will help. Those who don't really need it, Dad, Mom, come here, let's talk. What's happening? Let's do something. I'm referring you to so-and-so, and that's it. I'll do whatever I can to help. Congratulations on the person you are, the work you do, for being a wife, a mother, and especially a professional. I repeat, Mooshe. Her hashtag is here. Follow Dr. Vanessa Menezes. Recommend her. B. Tell her. B. Talk to her. B. Comment. Spread the word. Good people need exposure. They need a platform. Do you know someone who needs a truly qualified specialist? Someone who can give a diagnosis that's not only technical, but also extremely human. In this hour and a half here, Huda, you can see Vanessa's soul, which is very visible. It's frighteningly human. It's an astonishing missionary spirit. So, Bae, she's someone I would confidently entrust my patients to. Bae, I would definitely recommend her. So, if you're a mental health professional, and you feel what I felt, who would I refer my patient to? Vanessa is the person. If you know someone who needs help, I would recommend Vanessa. If you know someone who needs this knowledge, spread the word, follow, share, comment. That's our goal here at Divã with Dr. Andrea Vermont. To bring knowledge, to bring mental health, so that we can make good choices. Oh, our gift. Oh, here it is. Yes, Vanessa. We always offer a gift. It's simple, but it's just a little memento from our podcast for you to keep in your heart. Thank you. Thank you very much. It's a simple gift, but I hope you like it. I will keep it with much love and affection. Thank you. May it be the first of many. May God bless you greatly. Non, may God prosper you. Non. May God make your work fruitful. I love this bottle because this bottle is a cell phone holder. You can even record videos with it. Well, stick the phone there. Problem solved. Oh, how lovely. It's wonderful. I think this bottle is fantastic. I record my videos with this bottle. Put it there. Nail it there. Nail it there. That's it. Okay. Ooh, I already know how I'm gonna start. Perfect. You don't need support. Thank you, Dor. God bless you, dear husband. Thank you, I'm doing your part well. That's right. You have to accompany this girl. Support her. Encourage her. That's what you're invited to do in this life. You're married. Yes. And you're right. I say that one of the images that most catches my attention is that of Our Lady of Exile. Mary on the donkey. No. But the one pulling is Joseph. No. Facing the winds, facing the sand rains in the desert. He's there in his place, in the place where God planted him. I think the image of Our Lady of Exile is beautiful. So, I think it's beautiful when a husband comes along, pulling the donkey, playing his part. Congratulations. God will take you far. Thank you, God bless. Thank you, dear. Thank you. This is the podcast on the Divã with Dr. Andrea. It was a pleasure to be here with Dr. Vanessa. Thank you so much to everyone who has been with us until now. Quality content, with quality people, with people who are worthwhile, but also technical content. Here you will find technical content, and you will find soul. Do you want Dr. Vanessa to come back? If you've made it this far in the podcast, put hashtag #BringBackVanessa in the comments, and we will be delighted to bring her back. Follow our podcast, Krisa, share it, curry, subscribe, so you can receive more quality content. Help make this project a success by supporting it so it reaches a wider audience. Thank you very much. I look forward to seeing you again soon.